Okay, I wanted to go over some directional terms. So unlike human anatomy, dental anatomy uses terms specific to the tooth that you're talking about. So for instance, instead of like superior and inferior, we use the tooth specifically. So we'll use apical or incisal, or in this case it would be apical and occlusal. Okay, because molars have occlusal surfaces and anterior teeth have incisal surfaces. Other things, we use thirds to kind of break things up. So we'll use incisal third, middle third, and cervical third. And then for the root, we'd use cervical third, middle third, and apical third. Okay, and then same thing for molars, but here I wanted to show you, this would be the mesial buccal root. This would be the distal buccal root, and this would be the palatal root or lingual root. We typically say palatal. The way that you would know that this is the mesial versus the distal is just because it has a thicker root buccolingually, and then compared to this one, the distal root. And then also distal inclinations of roots. So typically in the posterior teeth, starting with the premolars, sometimes the canines too, they have a distal inclination, meaning all of the roots kind of angle towards the distal. So that's how you orientate yourself. Other ways that you can tell if it's a right or a left is the mesial on anterior teeth. The mesial CEJ tends to be deeper than the distal CEJ. Okay, so if you're having trouble distinguishing between right and left, you can use that feature as well. And then for anterior teeth, you'll notice that the mesial incisal angle is going to be more of a 90-degree angle, more like straight angle, and then the distal is going to have a more round angle. Okay, so those are directional terms and how to tell between right and left.